Welcome. I am Dr. Carol Rattay, the Director for Delaware's Division of Public Health, and I want to thank you for joining us this evening for a town hall on COVID-19 in children. Tonight's virtual town hall features a panel of pediatricians who will answer parents' most common questions about COVID-19. I'm joined by several distinguished panelists, including Dr. Priscilla Ampasi, who's a pediatrician and public health manager at Henrietta Johnson Medical Center in Wilmington, Dr. Maricel Santiago, who is the chief of pediatrics at La Red Health Center in Georgetown, and Dr. Craig Shapiro, who is an attending physician for the Division of Pediatric Infectious Diseases at Nemours Children's Hospital in Rockland. And also a warm welcome to our awesome sign language interpreter, Pam. So we're going to start this evening where I just want to share a little bit of information about COVID-19 in kids. And then we're going to have plenty of time for questions and discussion among our panelists. So if you can go to the next slide. I want to start by talking about why do we care about COVID-19 in kids? Children are not immune to COVID-19. Of Delaware children ages birth to 18,173 have tested positive for the disease in our state. Thousands of school-age children who may have exposed others in the school and in other settings. And while the severity of infection is typically less in children compared to adults, COVID-19 infection in children is not without consequences. It's important to remember that at least 430 children in the US, including 2 from Delaware, have died from COVID. And according to the CDC, pediatric hospitalizations from COVID are at their highest number so far. In Delaware, the number of hospitalized children and youth has quadrupled in the last month alone. Many children are at higher consequences due to their underlying health conditions. Delaware children who have asthma, cancer, those who are obese, or have other similar conditions are among those most at risk. Nonetheless, approximately 30% of hospitalized children have no underlying health condition and would be otherwise considered healthy. Let's move on to the next slide. I want to talk about something called MIS-C, or Multisystem Inflammatory Syndrome in children, which children are at risk for. It's a rare but serious condition associated with COVID-19 that requires hospital care. And we've had at least 4 cases of MIS-C in Delaware and over 4,000 nationwide. The MIS-C causes symptoms that are due to inflammation causing irritation, pain, and swelling throughout the body. Doctors are trying to find out how these symptoms are related to the coronavirus infection. The inflammation can affect the heart, the blood vessels, kidneys, digestive system, brain, or eyes. And sometimes this can damage the organs, especially the heart, or cause clotting in blood vessels. Some children with MIS-C also experience shock, which affects blood pressure and heart function. And these kids typically require critical care in the intensive care unit. I want to talk a little bit about the long-term effects. We don't fully understand what long COVID in children looks like, but we know that it happens. Headaches and fatigue are the most common post-COVID-19 symptoms, but children can suffer cardiovascular, respiratory, neurodevelopmental, cognitive, or brain fog, and mental health issues after being infected with COVID-19. So if we can prevent children from becoming infected, we should. And given that we are now seeing more spread of the Delta variant from children to others in the household, we know children are playing a bigger role now in putting others at risk, including those who are immunocompromised, elderly persons, and those who have chronic disease or are unvaccinated. So I want to talk a little bit about our Delaware data. Overall, among all age groups, we've seen an exponential increase in cases. For example, on June 28th, we had 10 total cases among all ages, in Delaware. So 10 cases at the end of June. And just last week on August 26th, we had 547 cases on that day. Since early June in children, our cases increased from 25 up to 84 in that youngest age group, the birth to 4 age group, which is that orange line on the chart you see in front of you. And among kids, school age kids aged 5 to 17, we saw an increase from 54 to 333, or it went up 517% among that age group. So you can see in the last month, we are seeing increases in cases among our pediatric population. And we are seeing an increase in cases across the state, in towns, cities, statewide. But the greatest increases are currently in Kent and Sussex counties, especially on the western side, where we have our lowest vaccination rates. Let me talk a little bit about pediatric hospitalizations. This is a question that we get a lot. Now, are we seeing more kids who are hospitalized? What our data are showing us is that the number of hospitalized children and youth did increase in the last month from 7 at the end of July to 28 by the end of August. So it quadrupled in that time frame. So we are seeing an increase in pediatric hospitalizations in our state. Now, if you look at in the southern states, and I'm sure you've all been tuned into the news where you've been hearing that there have been significant increases in pediatric hospitalizations. Pediatric hospitals in Florida, Louisiana, and Texas are reportedly overwhelmed with COVID-19. Certainly, we do not want to follow in their footsteps, especially when we know how to prevent these infections. I also want to take a minute to talk about pediatric clusters. Our epidemiologists work with people in childcare and schools and camps very closely to determine what when we have positive cases and how many. Now, we don't have a lot of data yet for our schools for this school year, since school is just opening. But we have over the summer been seeing multiple clusters, especially in the last month, in that early childhood setting. Like I haven't seen before, we're seeing more infants and toddlers who are becoming positive cases. And recently we've had 2 individual child care facilities that each had more than 20 confirmed cases. So it is spreading in these facilities. So not only, do we worry about the kids that are becoming positive, but in these sites, what happens too is that you end up with a number of individuals who end up quarantined, which what we've seen in our child care centers is entire rooms or facilities end up closing. Often what's driving a lot of this spread in these facilities is certainly with their youngest children, they're not vaccinated, but also the lack of mask wearing in this population. And now, additionally, among staff has been contributing to some of the spread. If you look on this chart right here, in the last month, these are looking at clusters from schools, camps, and daycare. All in total, we had 32 clusters. So you can see a big jump as of recently among the data that we're watching. And we're seeing in these clusters, the average cases, the average number of positive cases is about 5, but the average number of potentially exposed individuals per cluster is 38. So you can see that that ends up being a fairly large number of people who end up being in quarantine. So let me move on to the next slide, where I want to talk a little bit about what's going on in schools right now. And getting all kids back in school is such a high priority for all of us. We know that this has been incredibly challenging and not good for kids to not be face-to-face full-time over the last year. And so the American Academy of Pediatrics, the Centers for Disease Control are all strongly recommending that we get as many kids back into schools as possible. One of the challenges with that is just the space in these schools. So while the AAP and the CDC and in Delaware, we have for well over a year, recommend that you keep kids at least 3 feet apart as long as they're wearing masks. The full classrooms can certainly increase the risk to those who can't be vaccinated, which includes all those who are under the age of 12, but also is of concern to those who have chronic conditions, including those who are immunocompromised. So it's really important that we call it a layered mitigation strategy. There's a combination of protective actions that are helping to keep our kids safe. So vaccination is important. I'm going to talk about that more in a minute, but also mask wearing, the social distancing, screening for illness, routine testing, ventilation in the rooms, opening doors, or many have gotten new HVAC systems, hand washing or hand sanitizing, as well as covering coughs and sneezes and staying home when you're sick they all matter. They all make a difference. But I do want to focus on what the science says are the 2 most important strategies, which are vaccination and mask wearing. Vaccination is the most important tool for preventing infections and the consequences of COVID-19. And as I just mentioned, that under 12 age group is the only portion of our population that's not yet eligible to be vaccinated. And among the population of kids who are eligible, those aged 12 to 17, only 51.5% have received at least 1 dose and 40% are fully vaccinated. So while it's great that half our adolescents have received 1 dose, we still don't have the vaccination levels that we truly need in that adolescent population. So it's really hard to overstate how simple this is. Get vaccinated. That's it. Get vaccinated to protect yourself and to do your part to reduce community spread. When schools have staff, visitors, eligible students, and others in the school who are choosing not to get vaccinated, they are putting children and staff at risk. And staff and children who are able to be vaccinated can really help avoid putting others at risk by getting vaccinated. I want to, I'm coming close to ending my comments, but I want to talk about masking, which has unfortunately become way more controversial than it ought to. The science is clear that masks are one of the best protections that we have available. And particularly if you're not able to get vaccinated, there are abundant studies that show that masks work to prevent the spread of COVID. Some suggest by as much as 70%. And this includes studies that are looking at schools. So school districts with mask mandates have a lower rate of virus transmission from student to student, student to teacher, and teacher to student. Last year in Delaware, we saw minimal spread in schools, and we do attribute much of this to mask wearing because we really didn't have much vaccine around until towards the end of the school year. And so we have no doubt that masks make a big difference. And so what they do, they limit transmission and they protect people. They reduce the spray of spit and respiratory droplets, which protects you from other people and other people from you. It also helps reduce the need to quarantine. Correct and consistent mask use can reduce the number of people that need to quarantine when exposed to someone who's infected with COVID-19. Now, there's a lot of rumors and myths out there. What masks do not do, they do not impact lung development. In fact, they can help protect developing lungs from COVID-19. They don't weaken the immune system. They don't make it harder for children to breathe. They don't trap the CO2 or force us to breathe air we exhale. These particles are smaller than respiratory droplets, and they can get past the mask. A prior study claiming otherwise has since been debunked and is not a scientifically sound study. So let me close because I think we're all eager to get to questions. But I just want to point out to all of you that it's very helpful to stay updated on COVID-19 news in Delaware. And some of the best ways to do that are to follow the Division of Public Health on social media, or visit our website, de.gov/COVID vaccine. You can also find a list of vaccination locations there. And if you have any questions, remember, you can always contact the COVID-19 call center by calling 1-866-408-1899, or by sending an email to the DPH call center at dphcall@delaware.gov. So now let's move to questions from the audience. We've already collected several from the public that we're going to start with, but you can also type your questions in the chat feature where you are viewing. At this point, I'm going to turn it over to Emily David, who's going to start sharing some of the questions we have received.
Thanks so much, Dr. Rattay. The first question we have is a pre-submitted question from Christina. It's, since my son is not yet eligible for the vaccine, how often should I get him tested for COVID?
So I'll start with this one, and happy to have any of my colleagues here jump in. What we recommend for unvaccinated individuals, no matter what the age, is routine testing, weekly testing. So it is one of the best ways to screen and identify whether an individual has COVID, especially since at least 50% of cases are without symptoms. So weekly testing is what we recommend. I'll add to this that many schools are partnering with us or others to do weekly testing to make it easy, but you can always go to our website to find out what testing options are available that are convenient to you, including a number of home testing options now. Do any of my colleagues want to add in additional information or thoughts about testing?
Dr. Rattay, this is Dr. Pasi. I can add an additional comment to extend on testing. I think the question is an important one, is how do we keep our children healthy, those who are not old enough to get the vaccine? And I think we have to remember that keeping our children is really a family approach. So it actually really emphasizes the importance of why all family members who are eligible to get the vaccine should get vaccinated, because that will actually further protect your child who's not able to get the vaccine from getting COVID-19. So I think that's a really important question. And again, just underscoring the importance for all family members that are of age to get the vaccine to get vaccinated to protect our children who are not yet old enough to do so.
Thank you so much. And Dr. Shapiro.
Sure. Thank you, Dr. Rattay. So yeah, testing is really an important mitigation strategy. You know, it helps us to identify those individuals who may be asymptomatic and still can spread this virus. So I think it's very important, especially knowing that those who are unvaccinated or those who can't receive the vaccine are at greater risk of becoming infected, even asymptomatically infected. Being able to identify those people early and reduce spread, even among household members who may be vaccinated, is really a key mitigation strategy. I completely agree.
Thank you.
Our next question is for really all of the doctors on the call. What common concerns are you hearing from parents of your patients? And the second part of that question, what do you tell parents who are worried about getting their kids vaccinated?
Any of you would love to hear what you're hearing from your patients. I don't know if Dr. Santiago, if you want to share.
Yes, we most of our patients are concerned about the side effects. One of the questions that we have is that it's not completely approved, and we try to explain that to them. But I agree with Dr. Patsy that the most important thing to protect our kids is to have the family vaccinated. We try to explain to them and give them the data of how the numbers start coming down and how we know that the vaccine works. And sometimes it's a little harder in different populations to explain this, but we try our best.
Dr. Passy, what are you hearing greatest concerns from your patients?
Yeah, I would say the greatest concern that I'm hearing from patients and parents is they're hearing in the news, they're seeing the data that children aren't getting as sick as adults when it comes to the vaccine. So why give them a vaccine if they may not get sick? And, I could understand that thought process, but I really want to think about how do we employ general safety measures, right? And so a lot of times I talk about driving and a seatbelt, right? When adolescents start driving, even as adults, you could be the safest driver on the road. Yet we always put on our seatbelt. It almost is second nature because we're not sure of what might happen when we're on the road. There might be another driver that might cause an accident, and that seatbelt protects us, right? And so I think about that with the vaccine is that your child may not have some of the greatest symptoms from COVID-19 if they're vaccinated. With the vaccine, they might be exposed to it, and it would actually then decrease their symptoms overall, or they might not even have symptoms. And so to me, it's a protective measure, especially if they're coming around other persons who may not have yet gotten the vaccine or not old enough to get the vaccine. So if they're getting into school, they're around their peers, even with social distancing measures, they might have some contact. That vaccine is a layer of protection every day. And so that is what I'm really enforcing to our parents is that you can have the reassurance knowing that your child has some of the greatest protection, the vaccine plus masking from getting COVID-19.
Can I add something? Also, one of the things that we have to be fighting against is social media. All the misinformation there that the parents are receiving, it's really hard, and it's every day they're bombarded with that. Sometimes they believe more that than the actual facts. So that's one of the things I've been confronting a lot, the social media misinformation.
Yeah, thank you for adding that. That really is a challenge for sure. And Dr. Shapiro, what are the greatest concerns you're hearing from your patients and parents?
Yeah, so I mean, I'm hearing a lot of the same concerns, dealing with some of the side effects of the vaccination that I think have been widely publicized, namely, the inflammation in the heart muscles, and how that plays into the decision about whether to vaccinate their child, because there are people who think that that the likelihood of getting infected is low enough, or that the symptoms that the child may develop are not going to be so severe. Why am I going to potentially expose my child to a side effect from this vaccine? What I would say is that it's really it's frustrating. It's heartbreaking to see a child. I had to see one in the hospital today who was eligible to receive the vaccine and had just received their first dose, but unfortunately became infected and is now dealing with the complications of the virus, for which he most likely would have been well protected had he been able to complete his vaccine series. So, seeing these patients firsthand in the hospital, I think really brings it to a very personal level for me. We have a tool in our armamentarium, which we didn't have a few months ago, that can save lives. And that's I can't even begin to emphasize how incredible that is, that we were able to develop this safe and effective vaccine as quickly as we did, and get it out to people and get it into people's arms. We're seeing what it's doing in the adult population and all the deaths that it's prevented, and the same is true for our adolescents. And so I think it's really important to really emphasize them and on a personal level speak to the experiences that I've had treating some of these children that unfortunately wind up in the hospital.
Thank you for that.
Our next question comes from Faith. Dr. Rattay, I think this question might be best for you, but please chime in others if you feel like you'd like to. When do you expect the FDA to approve a vaccine for children 5 to 11?
Well, I wish I had a magic ball that would allow me to give a good answer to that. We've heard a lot of different answers, anywhere from October to late December. We do expect to see approval, FDA emergency use authorization for that age group, certainly by the end of the school year. We're really eager to see that approval, but there are still studies underway. And so it's not quite ready to go yet. But again, we are ready as a state. We have a great network, including the pediatricians that you see in front of you, that will help get this vaccine to that population as soon as it is ready. And I'll turn to Dr. Shapiro to see if he's got anything additional to add on approval for 5 to 11 or anything else on this topic.
Sure, thank you, Dr. Tay. So I have to start by saying that I'm not directly involved in any of the vaccine trials. So the information that I have is nothing more than what I think many of you have seen. But in speaking to some of my colleagues that are involved, I do know that they are getting this data out. They're going to get it back to Pfizer as quickly as possible, and there should be data to present to the FDA by September. Now it's up to the FDA to decide how long, how much data and how long post these clinical trials they want to, how much data they want to look at in order to authorize or make a decision whether to authorize the vaccinations in that age group. So that could put the timetable, yes, anywhere from October till probably December, depending on how much data they want to see. I know that they did ask the companies to provide some additional data and add more patients, which they've been able to do, mainly to see if there was any risk of the heart inflammation that was seen in some of the adolescent and young adult age groups. They want to make sure that they're not seeing any of this or more of those type of side effects in younger children. The other thing that they're trying to look at, of course, is the dose, the appropriate dose to give a young child. The child's immune system is very different than a teenager or an adult's immune system. So the dose of vaccine that we would be giving a child is going to be less than we would a child in the 12 to 15 year age group who are getting the same dose that adults do. So to find that that appropriate dose and the dose that's going to give the greatest immune response to protect children is really what's being studied. And once all that data is to the satisfaction of the FDA, I'm sure they will be working night and day to get that approved.
Thank you.
Great. Well, we are monitoring the Facebook comments, and it seems there are a lot of comments about schools going hybrid or virtual. And specifically, there's a question from Lee saying, what is the threshold for going virtual or hybrid? Dr. Rattay?
Yeah, it is a great question. And I think what we learned from last year is that identifying thresholds sometimes can be pretty tricky and not helpful. Because what we found last year is actually when we had very high levels of COVID in the community, the schools were able to operate safely. And we, again, attribute so much of that to mask wearing. And so really what we're looking at is what's happening in the school settings. If the schools are, doing the important things, those layered mitigation strategies, especially the mask wearing, but keeping kids distant as possible. Having kids test on a regular basis and staff so that we can do contact tracing, meaning identify that for those who are positive, they stay at home so they don't spread. For those who have been exposed, they stay at home in case they become positive, they don't spread. that's a really, really important strategy for decreasing the spread of infection. And so that's another key piece to this. I mentioned the ventilation as well. So, we're going to just have to wait and see what happens. The Delta variant is it's a different variant. It is more contagious than what we had seen before. But we're certainly hopeful that these layered mitigation strategies are going to keep schools open. You may find sometimes when you've got, a larger group of students in quarantine, if they were not socially distanced or not mask wearing, but otherwise, our hope is certainly that schools stay open and stay safe. But again, we're really eager to get all kids vaccinated, so that's so that we have certainly less worries, but also, we're eager to at some point be able to back down on some of these mitigation strategies. Love to hear if my colleagues have anything to add to that.
This is Dr. Pasi. I think one thing I will add, and Lee, thank you for that comment. And, I would say we really want to see our kids stay in school as long as possible. As a general pediatrician, I will tell you that back to school time is like my Black Friday. It's like my Labor Day sale. All the kids are coming in. And I will tell you this year, I've not seen so many kids who are excited to go back to school. Right? They want to see their friends. They want to get involved in sports. And many of them actually mentioned that they think they learn better in person, which is great. And so I think we have to be mindful of what can we do in the school setting, but also at home to reinforce these layered mitigation strategies to keep our children healthy, to keep them safe so that we can decrease transmission and keep the schools open. So we really are going to be looking to you, parents and caregivers, to remind your children when they're going off to school, keep your mask on, make sure you maintain your distance, wash your hands. Those are all really important. If that's reinforced at home, that becomes second nature as well. I'm telling you, I would love to see our kids get through the full school year if possible. And a lot of that can be done with these layered mitigation strategies. I'm telling you, kids are excited to get back to school, and we are so happy to see them getting back to that as well.
Great, thank you, Dr. Impasi. The next question, and this is for Dr. Impasi, Dr. Santiago, what do we know, if anything, about the long-term issues for children who have had COVID?
Well, right now we don't have a lot of information of that because when last year the COVID in kids wasn't that severe. The kids that did get severe symptoms, sometimes they do have some kids recuperate much better than adults, I would say. But sometimes respiratory problems. I had a patient that had COVID, is an adolescent, and is having a little difficulty playing sports again. He gets fatigued and he gets tired a little more than he used to. So he's taking it slower, but long term, we don't have the data yet completely, but as we see this year with the Delta being a little more contagious and more severe on children, we will have more answers to that. But right now it's more respiratory and that I see, and I had that kid in sports. They get tired more than they used to.
Great. And what do you all see as the most common side effect for children who after they get the vaccine?
I would say that the most common side effect of the COVID-19 vaccine is similar to the side effects of all of our childhood immunizations and vaccines, which is soreness at the site is one of the most common ones that I see, which is typical. There's a needle that's going into the muscle. It can cause a little bit of soreness with some heat packs, and sometimes some pain medication is very easily resolved. Sometimes there's redness at the site as well at the place of injection. There can be an elevated temperature that we see as well. And those are the three most common ones that I typically see, which is pretty standard across all of the vaccinations and immunizations that we give. I've been fortunate in my practice being at Henrietta Johnson that I've not seen other side effects, which I won't expect because, again, it is a vaccine as the other vaccines are as well. So we've been really fortunate. I would like to hear from the other panelists of what they've seen. But again, soreness at the site, redness at the site, an elevated temperature for a few hours are the most common ones that we've typically seen in our practice.
We do also, we have seen, the main concern is pain in the arm and a little bit of soreness. Some kids, I had very little complaints of high fever, sometimes body aches and a little, but I wouldn't say different than when they get the flu vaccine. So, and comparing to the parents, they have less side effects than the kids are showing, or at least reporting to us less side effects than the parents. So I think it's, yeah, I increased that it's safe. It's exactly like any other vaccine.
Great. Now we have a question more focused on mask wearing. It comes from Clint. Why are you mandating high school students mask up when they're eligible for the vaccine? And a second part of that question, why do fully vaccinated students have to wear face masks?
Yeah, so I'll take that one, and Dr. Shapiro might want to jump in as well. So as I mentioned when I talked about the data, for our adolescent population, only 51% are fully vaccinated, and I'm sorry, 40% are fully vaccinated. 51% have received one shot or more. So we still have the majority of that adolescent population that is not fully vaccinated. And so the majority of that population is still at risk. But unfortunately, just based on the numbers and based on how much COVID is in the community now, vaccinated individuals are at risk as well. As great as these vaccines are, you just look at the numbers. If you're exposed to high levels of this infection in the community, there's a risk that you may get infected. And so with that and some new evidence that shows that those who are vaccinated and become infected can spread the infection, the CDC came out with new guidance last month to say in indoor settings, it's recommended that vaccinated and unvaccinated individuals wear masks at this time. Dr. Shapiro?
Yeah, so I mean, I think as you mentioned, Dr. Tay, I mean, there's two ways to put an end to this pandemic. You know, one is to get enough people vaccinated, and we're really not close enough yet. And so until that happens, the other way that we can really drive down transmission, which we've done earlier in this pandemic, is to get people to wear masks, especially when they're interacting with each other in large groups, when they're indoors. We know that this virus spreads very easily, and the Delta variant even more easily than the original strains of virus did. And in schools in particular, as we've already mentioned, that's going to be the main way that we can keep these schools open, is to keep masks on kids so that we're not spreading, because there just aren't enough people that are vaccinated, and the youngest aren't able to be vaccinated. So masking is really going to be the primary way to prevent transmission. So it's, again, we're all in this together. It's not just about myself or my children, but it's about our whole community. And so we really need to in order to get this pandemic under control, we really need to look at it as a really group. It's a group effort. And so masking is really that most important tool after vaccination to keep those case numbers down.
Just to go back to our conversation around side effects, we're seeing a lot of questions in the Facebook feed about myocarditis. And I was just wondering if one or a few of you may want to touch on the topic of myocarditis as a side effect.
Dr. Shapiro, would you like to take that one?
Sure. So, I mean, I think that the CDC and the FDA have been looking at these numbers very closely. They continue to monitor them. It looks like, we have a reasonable amount of data at this point, and clearly the benefits of the vaccine far outweigh the risk of developing myocarditis or pericarditis, which is inflammation of the heart muscles, which is occurring in about 12 or so cases per million vaccinated. There clearly is definitely an association between the vaccination and these cases of myocarditis. I'm not trying to say that there isn't any association between the vaccine, but we know that developing inflammation of the heart is much more common when you are infected with COVID than it would be from receiving the vaccine. So, basically this and the inflammation caused by the virus itself is likely to have much more long-term implications than what's being found in terms of these patients who develop the side effect from the vaccine. Almost all of these patients, in fact, even the ones that have needed some sort of medical care, and most of them don't, but the ones that have needed medical care tend to get better within 24 to 48 hours. And to my knowledge, there haven't been any severe cases leading to death from this as a side effect. So the bottom line is that the vaccine is absolutely extremely safe, and the risk of any severe side effects to even a young child, and these are mostly males who are under 30 years of age, even in that age group, the risk of developing inflammation of the heart muscles is extremely, extremely low. And the risk of severe disease from the virus is much greater. And there's really no question the vaccine is much more beneficial than it is a risk to your child.
Great, thank you.
Another topic of conversation we're seeing a lot in the Facebook comments is about natural immunity. And I was wondering if you all could dive into why should we get vaccinated if we either have had COVID or have some natural immunity to it, or if you could just provide a little bit more background on that concept.
Yeah, you know what? I think we should toss that right over to our infectious disease pediatrician.
So, first of all, to develop, let's start with the basics. To develop any sort of natural immunity, you first have to be infected with the infectious, agent, and in this case, the SARS-CoV-2 virus. And with that, you run the risk of developing severe disease or even possibly, death from being infected. That's not going to happen if you're immunized. So you take that risk, out of the realm of possibility. We also know that, natural immunity is not nearly as long-lasting. It's not nearly as protective as vaccination. And many people who have been infected earlier on in the pandemic that had produced antibodies to the original strains of virus are no longer protected from these variants, including the Delta variant, which is currently greater than 90% of the infections that we're seeing are with the Delta variant. So being vaccinated, even in somebody who has previously been infected, will increase that protection from antibody production by a factor of at least 4. So you can feel much more confident that you are not going to either get reinfected or worst case develop severe symptoms or require hospitalization if you are vaccinated, rather than hope that your natural immunity is going to protect you.
This question comes from Jeff. What treatments are currently available for children who are diagnosed with COVID-19?
So that's a really great question. And since Dr. Shapiro, Dr. Impazi, and Santiago do care for these individuals, why don't we start again with Dr. Shapiro, because I know you care for a lot of these hospitalized patients, but would also like to hear from Dr. Santiago and Impazi how you're treating these patients as well.
Yeah, so I think we've already touched on this quite a bit, but honestly, the best treatment for our youngest children is prevention, is, vaccinating all of those people around that child. Kind of a cocooning strategy is what we refer to it as with other vaccinations, especially, we've done this for young babies with things like pertussis, making sure that the mother is vaccinated. And so it's the same thing for children right now that can't be vaccinated. You really want to get all of those family members, anybody that you can who's going to be around that child vaccinated. Now, we do have treatments available for children who are older than 12 years of age that meet certain criteria. The monoclonal antibodies that some of you may have read about are a very effective treatment that can prevent those who haven't been vaccinated from requiring hospitalization or developing severe infections, and they work quite well. They have to be given through an IV, and it takes about an hour to give the medication, but it's very safe with very few side effects and very effective. Now, again, only children over 12 years of age who meet certain criteria are authorized to receive that medication, and that's why it's so important right now that we try and prevent infections as much as we can in those younger children, and keep our kids home when they're sick from school so that they're not exposing other kids. Again, I think all the strategies that we've kind of already mentioned.
Great. Dr. Impazi or Santiago, do you want to talk about how treatment looks like from the primary care perspective?
Yeah, so I will say that I've been pretty fortunate to see limited cases of COVID-19 positive infection in our children. I would attribute that primarily to masking for children that have been able to mask, that have been able to social distance, not being exposed and not getting infected. In the few cases that I have seen, very fortunate that the symptoms were mild. Most common symptoms we saw were respiratory issues, so prolonged cough, fever for 1 to 2, maybe 3 days, some body aches, what you might see with other respiratory viral illnesses that cause the common cold. And we've managed with supportive care, close monitoring, of course. When we say supportive care measures, that includes, of course, treating the symptoms as we see. So primarily if there's fever and body aches, using pain medication, and then also managing cough and cold symptoms. For children, I did have 2 patients that had COVID-19 that had asthma. We've managed their asthma as they normally do, making sure they had their inhalers. And I use the word fortunate that they were mild cases because, as Dr. Shapiro has said and that he has seen, is that we do know that there are children who can become more severely infected with COVID-19. And so again, as we continue our layered mitigation strategies, as we continue our vaccine outreach, our goal is for that prevention. And so, I'm hoping that I see less cases even with schools reopening, and going from there. But it's been great that limited cases, mild symptoms, and again, the goal is to prevent future cases.
I agree. I've been fortunate too. We have not seen a lot of severe cases. Most of the cases we have seen, we have been able to manage and had not needed hospitalization. 2 of the ones that were a little worse were, like Dr. Bassi said, they had underlying symptoms of disease like asthma and some respiratory or preemie child, but they respond very well with support measure. We are also insisting in our practice in vaccines for parents, for adults, and now for children, that we have them available. And I think that prevention is the best treatment. I agree with 100%. It's the best treatment. We need to get vaccinated more.
And I just want to add, thank you, Dr. Sanchez. I was thinking when she mentioned the patients that you'd seen at Lorette. For us at Henry Johnson, I will say that the patients that we did see, child, adolescent, adults, were patients from all different spectrums, right? COVID does not particularly infect one type of person, right? We've seen it in Caucasians, African Americans, Latinx, Native American, all zip codes. If you live in 19801, 19720, if you have health insurance, if you don't have health insurance, if you're healthy, we've seen healthy patients contract COVID-19 and have severe symptoms, those with underlying conditions. Anyone can get infected from COVID-19. So I can say that the patient panel of those that have been infected, we're all different. And so again, it's being mindful that you might be healthy, you're doing what you need to do. It's what can you do to ensure that extra layer of protection. So I really wanted to emphasize that as well, is that anyone can get infected. And what we don't know is how your immune system will respond to it if you do not have the vaccine on board. So.
Dr. Rattay, we had a few folks commenting on Facebook asking for the latest data of COVID cases in children. I know that you spoke about that in your presentation, but I was wondering if you could just share a few of the key data points that you shared earlier with some of our viewers.
Yeah, absolutely. I'm happy to. And so what we've seen in Delaware among our pediatric cases, we went from so let's start with the birth to 4, so the youngest age group. In June, early June, we had about 25 cases. And then more recently in August, 84 in one day. So that was up 236%. And then in the 5 to 17 age group, it went in that same time period from 54 to 333. So, pretty significant increases in a short period of time for pediatric infections. As it relates to hospitalizations, in the month of July, we had 7 pediatric cases hospitalized for COVID, and in the month of August, we had 28. So that went up 4-fold. We are not at the levels yet of infection. Well, I shouldn't say yet. Some of the southern states, as we all have seen, have been hit really, really hard with COVID. What we don't know is what the next month or two will look like for us. Here more in the mid-Atlantic and northern northeast area of the nation, we have higher vaccination rates. Again, not where we want them to be, but certainly much higher than some of these states right now that are getting hit so hard. And also more people who are doing these layered mitigation strategies like wearing masks and separating themselves from others. So we may not, we hope we don't see the type of surge that has been seen in the southern states, but we certainly are seeing very significant increases right now in cases and hospitalizations for all age groups, including the pediatric population. And as I mentioned before, we've seen a lot more clusters in childcare now than we previously had, and we're seeing more infection among infants and toddlers than we had previously. So it's looking different.
And on that same note, Dr. Rattay and others, with those younger children, those ages 0 to 3, what should parents watch out for in terms of COVID? And that question comes from Elena.
I'm going to hand it to Dr. Shapiro. I think he was going to kind of jump in on the last one. So do you want to kind of segue to?
Yeah. Thank you, Dr. Rattay. Yeah, I was just going to say that, going back to the last question, that you're absolutely right. We're seeing increasing numbers of cases in the hospital. And we're hopeful that a lot of these layering mitigation strategies that you referred to in schools are going to be are going to be really helpful at keeping the numbers low. But I know that speaking to colleagues in the southern and Midwestern US, that they're really stretched thin, especially some of these children's hospitals are basically at capacity or over capacity. Thankfully, you know, at Nemours, we're prepared to handle whatever comes our way. But we're hopeful that we're not going to see some of the numbers that some of our sister hospitals in the South have been facing for the last few months. And so I think that the younger, going back to the question about the younger children, you know, again, things that you can do, how, you know, can't stress this enough, is just getting everybody vaccinated around that child. You know, keeping that child out of large crowds and you know, making sure that we're you know, keeping our hands sanitized and you know, making sure that you know, people who, if that child is around anybody, that those people are masked as much as possible, especially indoors if they're not part of the family. You know, I think that we're going to, you know, it's going to be difficult as the case numbers in the community go up. There are going to be more infections in those groups that aren't vaccinated. This virus is looking for susceptible individuals. And so the easiest group to target right now are those young children. So until we can get more of them vaccinated, I think we're just going to have to really, you know, be very vigilant and continue to follow all those mitigation strategies and the tools that we have available.
You know, I'll add to that, the American Academy of Pediatrics in their Pediatrics Journal last week released a study that was really interesting that demonstrated that infants and toddlers who are positive are now more likely to spread the infection to household members. We didn't see as much of that before. We saw more adolescents bringing the infection into the household before, adolescents being, you know, more social. But this was an interesting study comparing the pediatric age groups, and it's those youngest ones where there's close contact between the child and their caregivers in the home. But they, you know, those in the household do need to be careful when we have those positive cases of infants and toddlers. Dr. Shapiro, I'll hand it back to you and to all of my colleagues. I see we're at 7:58, so it'd be great to give everyone an opportunity for some a minute of closing comments. So Dr. Shapiro, it looks like you were going to add in there, so go ahead and do so.
Yeah, I was just going to say that I mean, I think that logically that study highlights the fact that those youngest children are the ones that are most difficult, you know, to prevent spread from, because one, we have a lot of close contact with them, and two, you know, they can't really protect their transmission of secretions when they're that young. So it's quite easy for somebody who's not protected, but even family members who are vaccinated can still have some breakthrough infections when they're in very close contact for long periods of time with young children. So, you know, again, we know that most of the spread is occurring in the household. Protecting kids in school is really important to make sure that we don't bring it back to the household, and so that we can, you know, reduce transmission in the community. What we would hate to see is that the numbers go up because of spread that's occurring within the school systems. And we know, because we've experienced this over the last year, that all of these layered mitigation strategies work. We were able to keep many schools open last year that weren't virtual, and the way that they were able to do it were all the things that we talked about, you know, keeping kids distanced as much as possible, at least 3 feet, and making sure they were wearing masks, making sure the teachers were wearing masks, and the cleaning and the ventilation. All these things will allow us to keep our schools open, to keep our kids in school, which is so important for many reasons that we've touched upon, their mental health, their education, the year that they lost. I saw a study recently about, you know, all of the impacts from an educational standpoint in the year that, you know, that many of these kids lost, in the testing, the grades. So I can't stress enough how important it is that we really follow these mitigation strategies. And I'm very appreciative of the governor and the Division of Public Health that support these measures throughout the state of Delaware.
Thank you, Dr. Shapiro. Dr. Santiago, any closing comments that you'd like to make?
Yes, I would like to insist in the same that we need to, the protection, we need to have our population vaccinated. And please to ask your providers, don't listen to social media. And if, I don't know if there's anybody speaking Spanish, if I'm allowed a moment to say something in Spanish.
Absolutely.
Si hay alguna población de alguien que está escuchando esta producción y habla español, por favor, lo que hemos hablado es de la importancia de estar vacunados. Es la única forma de poder combatir esta epidemia que tenemos. El uso de las máscaras, los niños de 12 años en adelante que podamos vacunarlos, por favor, a los padres, y para poder proteger la población que no se puede vacunar todavía. Por favor, pregunten a sus médicos y a sus proveedores, no hagan tanto caso a lo que ven en el social media y en Facebook. Estamos a las órdenes, cualquier pregunta nos pueden comunicar con nosotros en la red. Gracias. Thank you.
Thank you so much. And Dr. Pazzi.
Yes, thank you so much, Dr. Atay. I certainly want to first thank our Division of Public Health, Dr. Atay, for convening this town hall. And I want to commend all of you that joined for taking an hour out of your evening to really provide yourself with more education and to really hear about the science and the recommendations that we're putting forth. It's really important to ensure that you're getting accurate information to make important health decisions for your child, but also for yourself and for your family. And what I emphasize as a pediatrician and speaking with parents and caregivers is there's two considerations when you're taking an action of what if I do or what if I don't, right? And so we want to make sure that the decision that you all are making is in the best interest to protect the health and ensure the health of your child. And so for those, I know there were many questions and comments in the Facebook chat and the YouTube. If you still have questions, please reach out to your pediatrician. Take a moment to sit down and get those questions answered one-on-one. And if you are looking to, where can I get the vaccine now, right? You can go to de.gov/COVID-19 and find locations as well. It's really important that you're going to a trusted source to get information about what to do in those next steps to protect your child's health. And so I wish you all the best as we start, back to school. And, I think as Dr. Atay's emphasized and all of us on the panel, we want to make sure that we're getting our children as much of the school year in person as possible. So I want to thank all of you for your time and giving me this opportunity to share my insight.
Wonderful. Well, I am so grateful to the three of you for sharing your expertise tonight. Pam, as always, thank you so much for being with us, and to the audience, thank you so much for taking time out to be a part of this evening. So good night, everyone.